Hello everyone, Jen McNally, nurse practitioner at South Miami OB-GYN, here today with one of our leading experts in genetic counseling.
Hi, it's great to be with you today. My name is Jessica Ordonez. I'm a genetic counselor and Medical Science Liaison.
And we wanted to take advantage of Breast Cancer Awareness Month, which as you all know is the month of October, to give you a little bit more information and insight as to some of your options on genetic testing as it relates to breast cancer and other familial genetic inherited cancers. So just a fun, well, I guess maybe not fun, but a statistic that people talk about, breast cancer risk is 1 in 8 women. And so we're going to talk about some other risk factors and a more unique group that we like to test here in our office so that you get a little bit more knowledge and you can bring it up at one of your next visits with us. So let's get started, okay? So we have some questions. So here we go. So can you explain to us a little bit of how genetics is involved in breast cancer?
Yes, I appreciate that question because the truth is that all breast cancer is genetic in some level. And it comes down to there's changes in your DNA that drive cells to grow out of control, and that turns into cancer. But the hereditary piece is a little different because it means that people can be born with a genetic change that makes you more susceptible to develop cancer in your lifetime. So it's something that can be passed down from parents to children and can drive an inherited cancer risk.
So you're talking about like the one I think people are most familiar with is like BRCA1 and 2, genes of that nature.
Yes, yes. And in fact, BRCA1 and 2 continue to account for most hereditary breast and ovarian cancer.
Okay. And is there a group of people that have to worry about having BRCA1 and 2 more than others?
Yeah, that's a great question. So it's so important to know your family history, right? Both sides of your family, both the maternal and paternal side are important. And when talking about family history, people who have had breast cancer in multiple family members on both sides of the family, that could be a cause of concern. Young cancer, so think age 50 as a baseline. Before 50, it's something that you want to ask more questions about. Rare cancers like male breast cancer is also a risk factor for hereditary risk.
Okay. And how do I know if I have these risks? Just talking to my family?
That's the first step, but after that, there should be a conversation with your healthcare provider about genetic testing. And genetic testing is a way that can help us understand if someone has a hereditary cancer risk. That's the only way to really know if the risk is only driven by family history or if there's actually a genetic mutation that is associated with very specific cancer risks.
Okay. And how far back should I go?
Great question. You can go back as far as you can, but typically, first degree relatives, so parents, siblings, children, second degree relatives, such as aunts and uncles, and third degree relatives like first cousins as well. It's a good place to start.
Okay. And it's not just if I have a history of breast cancer, there's other cancers that should kind of be a red flag for me, right?
Absolutely. There's different risk factors. So for example, pancreatic cancer in a first degree relative, a reason for concern, ovarian cancer as well. Regardless of the age, those two types of cancers are very important for risk assessment. Male breast cancer, for example, ancestry is very important. If you're of Ashkenazi Jewish ancestry, Bahamian ancestry is very common in our community. It's important that you talk to your provider about it.
And just because I have a family member that would maybe have one of these genes, does that mean that I will necessarily have it?
That's a great question, and not necessarily. So if, let's say, your parent has one of these gene mutations, there's a 50-50 chance most of the time that you either inherit the mutation or you didn't inherit it. So most of the cancer genes are inherited in an autosomal dominant pattern. Men and women have it, and if you have it, there's a 50-50 chance that it can pass to the next generation.
So I think this is a perfect opportunity for me to use one of my favorite lines that I use with my patients, which is knowledge is power. And when talking about testing, especially something like this, I always say that as scary as something like this might be, it's so much better to be able to be proactive than necessarily to find something like this out, with a diagnosis of cancer, and then everything comes from a more reactive perspective.
Yes, genetic testing can be such an empowering tool to help you understand your risk, to make sure to get ahead of it and speak with your provider about different options that are right for you.
And so what's involved with getting this test done, and what's the name of the test you guys do specifically?
Yeah, so genetic testing is done via blood and saliva. Either one of them works perfectly well, and the test just tracks to see if there's a change in one of the genes associated with cancer that you were born with that could increase your cancer risk.
And what would a positive result mean? Like if I have one of these genes and I'm young, and what does that look like for me?
So if you have a positive result, first of all, it does not mean that you have cancer. It does not mean that you will have cancer.
Right.
It means that the risks are a little bit elevated compared to the average population risk. How much more elevated? It depends on the gene. So it's a more personalized risk assessment that can lead to conversations with your medical provider about what kind of screening is right for me. Do I qualify for any medications perhaps that can lower my risk?
Or more testing, right?
Or more testing, or in some cases also consideration of some surgical options too. So it leads to a conversation about your options and your family as well.
And I know sometimes this testing and results can then involve a woman, specifically for breast cancer, getting a score. There's been a lot of talk about your risk score and different criteria that then you may be available, an option for you to have an MRI. Can you talk a little bit about the score and how it's represented on your report?
Yes, absolutely. So the MyRisk with Risk Score hereditary cancer test involves kind of two different layers of risk assessment. So the first layer is to understand if someone has a single gene mutation that is associated with high cancer risk. So that is understood by testing dozens of genes that can be associated with 11 different types of cancers. But the truth is that most women are not going to test positive for a mutation in one of these genes. But the question that drove the testing to begin with is the same. What is my risk and what do I need to do about it? So there's another type of genetic changes that are called breast cancer markers that can elevate that person's risk for cancer. So the risk score component captures those breast cancer genetic markers. It can capture someone's ancestry as well as clinical history, risk factors, and provide you with a more personalized risk assessment as well. So
great.
It provides another layer of risk assessment that can help your provider understand what kind of options are best for you.
Okay, I think we did a good job at kind of putting out some basic facts and some, giving a little bit of a better idea to our patients. Anything you think any big takeaway that we should leave our patients with from your perspective?
I would say the holidays are coming. This is a really good time to talk about your family history. Know your family history. Both sides of the family are important. Talk to your provider about genetic testing and understand if it's right for you.
Awesome. Well, thank you for taking the time. And we are so lucky in our office to offer this amazing test and to have Jessica as a resource for us as providers. But additionally, MyRisk and their company has a wonderful array of genetic counseling options for our patients once your results become available or if there's any further questions. So it all starts with you. So go ahead and hopefully you'll do a little bit more research, get to know your family history if you don't, and then follow up with us here in the office.